So today's program I'm really excited about. Actually, it's the focus is on dementia care in the community, and by community we mean non-nursing home settings, in particular assisted living, people who are receiving care or services at home. Before I talk a little bit more and provide some more background about why we're doing this and why we put together these resources, just a little bit about the organization for those of you who are not familiar. The Long-Term Care Community Coalition, we're a nonprofit, nonpartisan organization entirely dedicated to improving care and quality of life for residents in nursing homes and in assisted living and older adults who are getting care in any setting. Um, we do policy analysis and systems advocacy. That's always been our primary focus. We do a lot of work, as I mentioned in the introduction, regarding publishing data, analyzing data, but we provide a lot of information for the public on, as I mentioned before, nursing home staffing, nursing home quality indicators, et cetera. All that is free to use and share from our website. Over the past 12 or so years, we've been doing more and more work educating consumers, residents, and their families, LTC ombudsmen, and other stakeholders around nursing home and assisted living issues. And we are the proud home of two local long-term care ombudsman programs in the Hudson Valley in New York. And our website is www.nursingHome411.org. Everything on the website is free to use and share. So a little bit about this project. We received this grant from the Fan Fox and Leslie R. Samuels Foundation about a year ago for something that has really been on my mind for quite some time, and that is the care, the quality of life, the dignity of individuals who have dementia but are, living outside of nursing homes. So the two essential goals of this project was one, of course, at its heart is to improve dignity, improve comfort, and bring best practices to dementia care and people who are living with dementia in these, what we call home and community-based settings, or HCBS, and that includes assisted living. As an integral part of that is to empower families and professional caregivers with tools that they can use in their practice and to foster better care and services for those individuals. So why is this project needed? Well, a growing number of people are living with dementia and receiving services outside of nursing homes, and in particular, quite often in an assisted living, in a so-called memory care unit, which tend to be, not all of them are, but tend to be in assisted living facilities, or are living in their private home. They're remaining there and they're having, services come in or not, to the extent that they are able to. Unlike nursing homes, those settings don't have formal dementia care standards. So our work over the years has really focused on nursing homes. And there was a federal report from the Office of Inspector General of Health and Human Services, a couple reports that came out in 2011, 2012, that found that there was an enormous amount of antipsychotic drugging of residents in nursing homes with dementia to sedate them. Rather than providing them care and services, these residents were sedated, generally speaking, to address what are called, the so-called behavioral and psychological symptoms of dementia. People that may be crying or lashing out or expressing pain or discomfort in different ways, that they were being overly medicated. And since that time, since 2012, we as an organization, as well as other organizations and including providers, of course, and including the federal government, have been very focused on improving the nursing home requirements related to dementia care and related to antipsychotic drugging or psychotropic drugging and the use of psychotropic drugs inappropriately as a chemical restraint. But it's always bothered me as someone who's done research in this field, who's been an advocate in this field, that we are not paying attention to, again, these growing number of people who are living with dementia outside of nursing homes. And although the nursing home standards, of course, do not apply in assisted living, they do not apply in health, excuse me, in home care. Uh, every individual deserves to have the quality of care and the services that they need to live comfortably, to live with dignity, etc. And it was, it's long been our view that even if there are not federal rules for dementia care in home and community-based settings, everyone also has the right to receive care that comports with professional standards. And that's really kind of the heart of how we are trying to, that we built on the resources that we're going to talk about today. And what we leverage is, okay, what are the professional standards? Nursing home standards are based upon professional standards. Everyone has the right to have care and services that comport with professional standards of care. Oops, sorry, I went the wrong direction. There we go. So I just wanted to know as we're getting started here that one, inappropriate dementia care hurts everybody. It certainly obviously hurts the individual who is not getting care properly, but it hurts their family member. It hurts professional caregivers. It makes their life more difficult, actually. It puts them at risk, caregivers, whether they be aides or professional nurses. It puts their health and their welfare at risk when residents don't, or excuse me, when individuals, pardon me, don't receive the care that they need. And it also impacts owners and operators. I mean, good dementia care is a essential component of senior care or elder care, whatever you want to call it, that is provided in assisted living, that is provided in home care settings as well. And with the growing aging population, this becomes really important. And so when there's not good care, that really does affect, obviously, it affects the individual the most, but it affects everybody around them. Conversely, good care benefits everybody. Good care obviously benefits the individual, and therefore it benefits the family member who is concerned about the individual, who is working with the individual, and likewise for the professional caregiver. If they are equipped, if they're implementing care that is based upon comfort and based upon respect and is really addressing the underlying issues that a person with dementia is or may be experiencing, that is beneficial to them as well. And of course, I think for owners and operators of whether it be an assisted living or a home care agency, having satisfied customers, having workers who are not endangered, who are not upset or disgruntled, benefits them as well. So it really is. I mean, I know sometimes it can be hard to see because we're in a world where there's a lot of cost cutting and things move very fast. But if we're able to take a step back, and we've seen this certainly with nursing homes that are practicing good dementia care and assisted living for that matter that are practicing good dementia care, that it is beneficial to everybody involved. So I just want to talk briefly, for each of these categories that we were just talking about, why this matters to people living with nursing homes. Excuse me, pardon me, people living with dementia. So importantly, and I think, as I note here on the side, it's one of the biggest lessons that I've learned over the past, 12 or 13 years that we've been focusing on dementia care in the nursing home world is that all behavior is communication. When an individual with dementia is upset, is expressing that upset in different ways, and it could be that they are lashing out, it could be that they're crying or spitting or wandering, etc. All of that is communication. They are trying to communicate something. So it's important, as I know here in the first bullet, to understand that people with dementia have unique ways of expressing pain, discomfort, or fear. If they're uncomfortable, say they haven't gone to the bathroom in 3 days, they can't say that necessarily. So they're going to express their discomfort in different ways. And that's true if they feel like they're being treated in an undignified manner. It's true if they're feeling fear. It's true if they're feeling bored, is that they can't just say, I'm bored, I want to do something else. Or, the TV show that you put me in front of is really annoying to me. I want to do something else. I want to listen to music or take a nap or color or whatever, or draw or paint. They can't say that. So it's really up to us to figure out what their behavior means and what they are trying to express. Similarly, as I said a little bit before, is that families need support and guidance to navigate this. I think what quite often happens in situations, especially in institutional settings, is that an individual may have a resident, say in an assisted living or a nursing home, may be upset. They may become disruptive. They may be having so-called behavioral symptoms of their dementia. And of course, as a loved one, as a spouse or partner or child, etc., you say, I want that person to be calm. I don't want that person to be upset. So too often, we've all kind of, turned to, okay, what calms them down? Well, obviously, a sedative drug will calm them down. However, as we've learned, through the years of working on nursing home issues, those sedative drugs really are just a form of chemical restraint. They don't help address the underlying issue. Is the person, as I mentioned before, are they constipated? Are they bored? Are they in pain? Maybe they have a lower back ache and they can't say, I have a lower backache or I have a headache or the light is shining bright in my eyes right now and it's really annoying and I don't know how to tell you that I need to move. So all I could do is kind of lash out and try to bring attention to the fact that I am, as an individual, uncomfortable. So we understand that families, of course, want to see their individual comforted, but it's important to understand what that actually means, and that means addressing, some of the underlying issues, not just covering them up necessarily with medication. And as I noted a bit before, how does this matter to professional caregivers and to providers, to operators and owners of home care agencies and assisted living and other service providers? Is that, it's valuable and important to have tools, to have, to have the knowledge, but also to have the tools that you can use to implement that knowledge in order to provide care that is more comforting, as we often say, that addresses the underlying issues of why a person might be behaving a certain way, why they may be upset, etc. So what we put together here, and Haley and Rachel will talk more about it, is we put together a library of pretty easy to use, again, evidence-based tools. So we went back and we did a lot of research. We talked to people who worked in this area for many years, but we did a lot of research to form an evidence basis of what are professional care standards for people living, with dementia, no matter where they live. And so we've worked to translate those standards into something or into to resources that are easy to use, that are clear, and that are practical, for both families who have a loved one with dementia, but also for professional caregivers, people who are encountering, individuals and their families who are experiencing different common issues when one has dementia. And of course, here's I know our ultimate goal is to drive lasting improvement. And we'll continue, even though this project is over, as we do with all our resources, we'll continue to build on it and update it in the months and years to come. So with that, I'm going to turn it over to Haley.
Thank you, Richard. So hello, everyone. Thanks so much for, excuse me, I have a little bit of a cold, so you'll have to bear with me. But thank you so much for joining us today. For those of you that don't know me, I am Haley Cronquist. I'm the Associate Director here at the Long-Term Care Community Coalition. So now that Richard has talked about the importance of high quality, person-centered dementia care, I'm going to walk you through some of the practical tools that are available in the toolkit and how you can use them in your daily caregiving, advocacy efforts, or training efforts, anything of the like. So here is our fact sheet. This toolkit is really thoughtfully designed to support individuals living at home or in assisted living, but also for the people who care for them. And our aim is really to equip people, family members, ombudsmen, caregivers, advocates, and other stakeholders with practical tools, like Richard said, grounded in academic research and professional care standards. Each fact sheet is intended to explain what good dementia care looks like clearly and accessibly. And they provide useful context for why a particular care strategy matters and offers practical tips that can be applied in real world settings. So, some of our topics include care planning, engaging activities, home safety, pain assessment tools, preventing pressure ulcers and urinary tract infections, and understanding and responding to dementia-related behaviors. And I have behaviors in quotes there because, as Richard noted earlier, behavior equals communication, and that's just really important to remember when caring for someone living with dementia. Next slide, please, Richard. So our care cards, which I'm going to show you all of this on the website and how to access it as I go, but our care cards boil down the information from some of the fact sheets to the essentials. So these are perfect for maybe like a staff bulletin board or a caregiver training folder or hanging on your fridge at home or having on hand, during care planning. And these are also a great conversation starter for families and care teams working together to improve care. And again, they're quick hits from our fact sheets. So you can find all of the same information on our fact sheets, but if you want just kind of a quick card to hand out, this is something that can be used for that. Next slide, thanks. So how to access. So everything that we will show you today is available on our website, free to download, free to print, and free to share. We really encourage you to explore the full toolkit and help us share the word because really these tools are going to be the most powerful when they're used regularly and shared widely. So for an example, if an individual is showing signs of distress, a care team might turn to the communication tips care card, just quickly brainstorm how to handle that situation. Or a family member might use the informed consent care card to prepare for a care planning meeting. So again, these can be used in so many different ways. And again, they're going to be the most helpful when everyone has access to them and knows where to find them. So I am going to quickly share my screen. Richard, I'm going to take over. Thank you. And I'm going to show you. Okay, so you should be seeing now actually, sorry, I'm going to take you back to this page. This is kind of our landing page for our dementia care toolkit. So as Richard mentioned earlier, we have previously put together a toolkit for nursing homes, and you can find both of those here. So here you would click on nursing homes, but today we're focused on private home and assisted living. And these can be found by going to the Learning Center drop-down tab at the top and clicking Dementia Care Toolkits, and that'll take you to this landing page. So here's what our dementia care in the community toolkit looks like, which again is designed to support people living with dementia in assisted living and home care settings. So here you can kind of see how the toolkit is laid out on our website. We have an introduction here that's just kind of on the importance of good dementia care no matter where someone lives. And then if you scroll down, we have all of our fact sheets here, all of our dementia care cards, and external resources, which Rachel is going to take you through once I wrap up here. So I just wanted to kind of give you a quick, actually, I'll scroll down to the fact sheets just so you can kind of see. These are all of the different topics that we've covered. And again, like Richard said, this is a resource that we'll continue to work on. So if anyone has an idea or if you think something is missing, definitely feel free to reach out to us because we're always looking to improve our resources for you. So here you can see all of the different fact sheets. And then I'm just going to show you just a couple just so you can kind of see, I have to pull this down, just so you can kind of see what they look like. So this is our home safety fact sheet. So this just provides essential tips on, fall prevention, environment adaptations, and hazard removal, because you really have to think about someone's safety when they're living at home or in assisted living with dementia, because like this fact sheet says, dementia can impact thinking, movement, behavior, sensory perception, and it leads to increased safety concerns. So we wanted to make sure that we address those. So we included a bunch of home safety tips on, your kitchen, your bedroom, bathroom, lighting. Wandering prevention is really important when it comes to people living with dementia. So this just provides all of these tips. And then this fact sheet has a corresponding care card that you can see here. So like I said, these are just kind of quick hits from the fact sheets. So here you can see we provided all of the tips for this is like maybe something that you hang on your fridge at home. And it's just kind of a reminder to think about things that you might not really think about, because as someone, progresses with dementia, their maybe sensory perceptions get a little bit worse, but you don't always like, you have a lot going on as a caregiver, and we want to kind of make it as easy as possible. So here's this home safety tips. So evaluate the environment. Regularly check high-risk areas, clear clutter and tripping hazards, and update your home safety setup every few months. This is something, like I said, it's important to remember as people progress. You want to keep things updated. Your kitchen safety. Use automatic shut-off appliances and secure stove knobs and cabinets containing hazardous substances. Add picture or word labels to cabinets to support independence. So just a quick story on this. When I was in high school, we had a neighbor across the street, and he was living at home, but he had pretty advanced dementia, and his wife was his caretaker. But if she ever needed a break, I would go over there and I would just sit with him, watch TV, do whatever he wanted to do. But I remember so many times he would get up to use the restroom, and then I would have to kind of monitor him because he would always turn on the stove. That was just kind of something that he did. I think he may have cooked, before, but he would always turn on the stove. So it's just something that you have to kind of keep an eye on. So bathroom and bedroom safety. Add grab bars and non-slip surfaces to the bathroom. This is something you see often in older people's homes, and it's just such a safety, it's just an easy safety thing that you can do to keep someone from slipping in the bathtub or having a fall. Keeping the bedroom tidy and securing furniture to prevent falls and tipping. Lighting and visibility. Add lighting in hallways, bathrooms and stairs. Use night lights to prevent disorientation, especially at night. And wandering prevention, like I mentioned earlier, this is really important when it comes to people living with dementia. So installing locks on doors and windows that are out of sight to prevent wandering. Emergency preparedness. Have emergency contact information like your local police station or hospitals easily accessible. And then lastly, medication and chemicals. Store medications and hazardous substances such as cleaning fluids, windshield wiper fluid, etc. in a locked cabinet, and consider using a pill organizer to ensure proper dosage. And then I just want to show you the second part of all of the care cards. They all have this information on the back. So this, it just kind of gives you a link to our website, a link to the toolkit, and kind of what we provide, just so that you always, if you're handing this out to someone who's maybe not familiar with our organization, now they will be, because they'll have this information on the back of their care card. Excuse me. So this is our psychotropic medication fact sheet. We talk about the risks, benefits, and questions to ask. This is really important. If you've done any research on dementia care and psychotropic drugs, there's a really big risk in taking those and living with people living with dementia. They can be excuse me, they can be very dangerous. So it's always important to note what someone is taking and ask questions about, whether or not it's actually necessary and what it's prescribed for. So it's just really important to have all this information. So we provided the common types of psychotropic drugs. There's a list of AP drugs on our, antipsychotic drugs on our website that you can also access. And then again, it's just the risks, questions to ask the doctor, and then what you can do as a caregiver. So it's just really important again to ask all these questions and just make sure that you have all the information that you need. So this again is a care card that is just corresponding to that fact sheet. Again, behavior equals communication. Know the risks, know how to handle a crisis, watch closely for side effects, ask questions, and then remember, this is really important. Remember that the individual or the designee always has the right to ask questions and or refuse treatment. So if you don't think that, something is, again, I'm not a clinician. We always make sure to say that we are not clinicians, but that's why it's important for you to know what questions to ask, so that you have all of the information. And that takes me to the last fact sheet that I'm going to show you today. Again, they're all available on the website, free to download and share and print. So please take a look through all of them. I hope you explore them. But I just wanted to transition from, drugging to non-pharmacological approaches. Excuse me. This fact sheet highlights alternative strategies such as music therapy, pet therapy, and other behavioral interventions that prioritize quality of life over medication. And again, sorry, I just have to throw in another quick story. I was just visiting my grandmother in Arizona, and she lives in an assisted living facility, and she has dementia in that she has some memory issues, but she's not really that advanced. But we did get her one of these. I guess it's a fake cat that they sell for people living with dementia. They're targeted for them, and it sits in the corner of her apartment, and sometimes it meows or whatever. And she still knows that it's not a real pet, but she really does find so much comfort in it. Sometimes she'll pet it. She hears it meow in the corner, and so I was a little wary about that, to be perfectly honest, but it does bring her some joy, and that's really all that we can ask for. So I'm really pleased to see that, and I'm glad that we're able to highlight pet therapy. So anyway, these just highlight alternative strategies that prioritize quality of life over medication. So excuse me. So I'll just scroll down just a little bit. The value of non-pharmacologic approaches, professional standards of dementia care, common approaches, and then again, we just go through some of those different therapies and intervention and other activities. And we have, again, more fact sheets on this and more tip sheets, so please be sure to check those out. And again, these can be used in so many ways, and we encourage you to do that. But for now, I'm going to pass this off to our policy fellow, Rachel Farber, and she's going to take you through some of our external resources that we use to make these tools, as well as some that we just wanted to highlight for people so that you can have them all in one place.
Thanks,
Thanks.
Haley. I'm just gonna share my screen too. And as Haley said, my name is Rachel Farber. I'm the long-term care policy fellow, and I've spent a lot of time over this past year in my fellowship working on the Dementia Care in the Community project. So it's really exciting that we're getting to present it and show what we've been working on. So as Haley showed you, this is just the Dementia Care in the Community page where you can see the fact sheet that she talked about, as well as the dementia care cards. And then if you keep scrolling, there's an external resources section down here. So a lot of our fact sheets, as Haley showed, we really tried to keep them to 2 pages just for easy use for people and just to have everything in one place. But as we were creating the fact sheets, we came across a lot of incredible resources that couldn't quite fit all of them in the 2 page fact sheets. So that's why we created this external resources section. And it's kind of split up in a similar way as the fact sheet topics are, as we used a lot of these resources in creating the fact sheets, and a lot of the resources went into what we ended up putting in the fact sheets as well as the care cards. So you can see, for example, the care planning one that corresponds with this care planning fact sheet that you can find up here. But if you were someone who looked at the care planning fact sheet, which is right here, you went down, you're like, oh, I want to find more information than the 2 page fact sheet would give you, you would go back, scroll down to external resources, and you can click on the care planning external resource page, and it'll take you to a page that looks like this. So we just have a little summary on care planning at the top, and then we list out different resources that we highlighted, as Haley said, that either we used in the drafting of our fact sheets or that we just came across and just thought that it would be valuable for people to be able to access and see them all in one place. And these resources are different things from research articles and journals to web pages to toolkits created by other organizations that we thought were valuable and were important about the topics that we wanted to highlight in the fact sheets and the care cards. So this care planning page, you can see different resources listed. So like the 4Ms framework for person-centered care we talk about in the care planning fact sheet, but if you wanted to find more information, you could go ahead and click this and the link will take you directly to this webpage from the John A. Hartford Foundation that does a lot of good work. And so you can just read more about the 4Ms framework. Is something we talked about in our fact sheet, but this gives just more information and obviously is longer than the 2-page fact sheet. And we set it up in a way where you can see the title of the resource, where the resource is from, as well as the authors, if it's a study, like this one above is a case study, and then the link right there. And then we also included a short summary, so like a 2 to 3 sentence summary on what the resource is and what's highlighted in the resource. Again, just as a way for you to get more information and to be able to easily have access to what that resource is talking about. And it also kind of says what the resource is. So this one says this is a blog post, this is an article, and this one is a case study. So a bunch of different types of things that we just wanted to include for people to be able to easily access more information from our fact sheets and from important topics that we wanted to highlight. And so I showed you a web page, and then if you go down here, this one is a peer-reviewed research article from the Journal of American Medical Directors Association. So you can click on it here. Again, it takes you to a new page, and you can see that this is a journal article here. Not all of them, not all the journal articles are freely accessible online, but if you really wanted to read this specific one, you could pay for it. But a lot of the web pages and other articles and stuff are free online. We also just wanted to include it because we thought, they were important, different types of articles and different studies and things like that. Even if they're not freely available online, a lot of them went into the fact sheets or just, created different things for us that we thought were important. So yeah, this is the care planning one. We a bunch of different resources on here that you can see the summary of and see the link to if you want more information. And then going back, so we have them all linked here. I also wanted to highlight this Dementia Friendly Initiatives one, because this one, we have a fact sheet for this topic, but some other organizations like from the Dementia Friendly America, this is a toolkit, an online toolkit that we summarized, and I'll click to it and show you. It's kind of like an interactive web page toolkit that was just cool. Then we wanted to be able to link to this resource so people could see what other organizations and what other research is out there on home and community-based services and care for people living with dementia, because there's a lot of cool resources out there. And then we have more called the Dreamscape Project, which is another cool different webpage that we link to. And then going back, some other ones, pain assessment. We also have a fact sheet on pain assessment tools, but if you wanted more information, again, you can click on it and see what we have here and see different pain assessment tools that we used. And then like this one also links to the exact PDF page of the pain assessment tool. So yeah, we just wanted to highlight different resources and I'll go back. And just make sure we used a lot of these resources in the fact sheets, like I said before, but there's just so many good resources that are out there that we also wanted to highlight and provide summaries of, and just easy access for people to be able to look at. I can stop sharing my screen.
Thanks so much, Rachel. And I saw in the chat, someone said to slow down a bit. I know we went through those resources pretty quickly, but they are all available on the website. So you can definitely feel free to explore the excuse me, feel free to explore the toolkit, explore the fact sheets, the care cards, and all of the external resources. That's why we linked them, because obviously even in the even in this webinar, we don't have the time to go through each one, but they are available there for you. And again, like Rachel was saying, if some of them don't provide such as a research article for free, you can still access our part of the website where we do offer a little summary of the resource. So I hope that that's helpful for everyone. So we just have a few more slides here. So basically, we have built the foundation with this toolkit, but now we are looking to take the next step, and that is getting these materials into communities, into care settings, into people's private homes. And so we are seeking additional support, and with that support, we hope to conduct targeted outreach and education, ensuring that individuals living with dementia receive the compassionate and person-centered care that they deserve. And so we really hope that you will be part of this effort by sharing these tools, using them, and helping us reach new audiences. And again, if you're not already, I hope that you are subscribed to our emails, but if you are not, please visit our website. I can put a link in the chat if you need to subscribe to our emails. It's www.nursinghome411.org/join. And again, I will put that in the chat. And you can please, again, explore all of the resources on our website. And please just share them, because that's how we're going to get them into the hands of as many people as possible. It's just word of mouth, or handing out care cards. Maybe if you're an ombudsman and you're visiting an assisted living facility, maybe taking some of those with you. That would be really helpful for us and for everyone involved. So please share as widely as possible. And you can go to the next slide, Richard. Thanks so much. So again, head to Nursing Home 411. Materials from today's webinar, the recording of the webinar, the PowerPoint, and all of the resources that we discussed today are available on our website at that address, and I can put that in the chat as well. Please follow us on social media. We post a lot of updates, upcoming webinars, other resources that we've come out with on our social media. So if you miss it in an email, you can see it on social media. And then please visit our Learning Center. Our Learning Center is full of, again, free resources. We can't stress free enough. But we have fact sheets on key nursing home standards, assisted living guides, family empowerment resources, and our resident abuse, neglect, and crime reporting center. So just a quick announcement. Normally this slide is announcing our upcoming webinar, but we are going to take the summer off. We are taking off July and August. When I say we're taking the summer off, I mean from webinars, definitely not from work. We will still be providing a ton of different resources throughout the summer and working hard to support, good care in nursing homes, assisted living, and private home care. That's always our focus. But I just wanted to let you know that we will not have webinars in July or August. But again, make sure that you are subscribed to keep up with our work. And then we will see you in September. And we already have a few really great programs scheduled for the fall. So again, be sure to make sure you're subscribed to keep up with our information. And then for updates and invites to future programs, again, please make sure that you are subscribed. And if you are an ombudsman joining us today, look out for an email confirming your attendance of this program. And we are so happy that you joined us. Thank you so much. And now I think we have a couple questions. Richard, I don't know if you want to take on some of the questions.
Sure. Let me just open it up. So Keith Tinsley asked a couple questions. Thank you, Keith. One was, isn't the state requirements a lot different from the federal requirements according to the Code of Federal Regulations? And yes, that's certainly true. However, it's in what we're focusing on here, which is home care and assisted living care, which together are referred to as home and community-based settings, there are really there are really no federal requirements. The only federal requirement regarding assisted living is related to the home-like characteristics of a setting, and whether a setting like an assisted living is truly providing a home-like environment. But in terms of quality of care, certainly in terms of dementia care and services, there are no federal requirements whatsoever. There are some, state rules. I think every state now has rules around assisted living. We've actually done some research on that over the years, highlighting some of the more promising assisted living rules. And as I think Haley mentioned, we have our assisted living guides on our website as well. And all of that is, again, as Haley mentioned, free to use and share. So I would welcome everyone to visit those guides, look at those materials if you are interested. But just importantly, to respond to your question, is the reason why we did this project is because there are no rules regarding quality of care, quality of services, who's providing those services, dementia care specifically in regard to assisted living and home care. And I should add, as I said earlier on, a lot of the work that we do, in addition to public education like this program and these materials, it relates to policy advocacy, policy research, and data. And a lot of that, unfortunately, is not possible with assisted living and home care because we just don't have the data, because we don't have the federal rules around it. So it makes it a little more difficult to know what is going on in assisted living, for instance, or what is going on, with a home care agency, for instance, in regard to, say, their use of antipsychotic drugs, or other issues, relevant to the quality of care provided, because the data just are not there. And that, again, in turn, makes it important from our perspective that individuals and their families, ombudsmen, and care providers, professional care providers, are well equipped with the knowledge that they need and practical resources to implement that knowledge to provide good care. Keith asked another question. My understanding is the states only have to provide minimal care while the federal has to provide maximum care. I'm not sure what that means. To be honest, I'm sorry. It doesn't make sense to me. But again, as I mentioned before, there are no federal standards regarding the quality of services, dementia care services, or otherwise in home care or assisted living. There are substantial rules and requirements regarding care in nursing homes. So there is that difference there. And then in the nursing home world, states can have additional rules. So they can't have any rules that undermine the federal rules, but they can have additional rules. For instance, even though until recently there was no state minimum standard for, there was no federal minimum standard for nurses in nursing homes. Many states have minimum standards for the number of nurses that need to be, or certified nurse aides that need to be in nursing homes. So that's an example of a state having an additional protection, but no state can have a lesser protection in the nursing home world. In the assisted living world, it's kind of the opposite. As I said, there's really no safety or care standards on the federal level, but I think every state now has standards regarding assisted living, but they tend to be weaker, and they tend to be, in our view, more weakly enforced. But with that, I think, unless we have any other questions, I thank everyone for joining us today. And Ellie, are you seeing anything, or we're good?
No, sorry, I didn't see any other questions in the chat or in the Q&A. Oh, actually, I think one just may have popped.
Keith just said thank you.
Thank you.
Yeah,
Okay.
and thank you, Keith, for joining us.
Yeah, and I just want to thank everyone. I was just reading through the chat while Richard was speaking, and it sounds like everyone is really excited about this new resource and sharing it. So we really appreciate that, because again, just getting this resource out there is going to be the most helpful for people living with dementia, for families, for caregivers, for everyone. So thank you so much for joining us and for sharing this.
Yeah, thanks very much. Have a nice afternoon. Have a good summer, everyone. We'll see you in a couple of months. Bye-bye now.